Okay. Thanks everyone for coming. We'll go ahead and get started. So we'd like to thank everyone for coming and being here today. We are recording this presentation if you need to go back to it or if you want to share it with your friends and family members. So it will be posted live on Facebook right now and then on YouTube a couple hours after the presentation's over. So just a little bit about ElderWorks before we start. We are a nonprofit 501c3 organization, and we provide older adults, seniors, and family members with information, referrals, and guidance for senior living, home care, and support services. And the guidance we provide helps seniors stay at home well or transition successfully into senior housing. And during the month of October, we are running a food drive to collect food for local food pantries. So if you are in the Palatine area, you can drop off non-perishable food through Halloween as the last day we'll be collecting it, and then we'll be distributing the food to local food pantries all across the suburbs of Chicago. We do have an Amazon wish list as well if you live further away from Palatine and wanted to donate. And we also have locations. We have 10 to 12 locations kind of all over the suburbs as well. So if you want more information, you can just put that in the chat and I can email that to you. And we will be doing gift wrapping this holiday season as well. So keep an eye on your email for more information. And after the presentation, we have a little survey that we'd appreciate your feedback. And throughout the presentation, we will, you can definitely put your questions in the chat, but Santonya will address them all at the end. So you can put them in chat or the Q&A, either way. So we're so happy to have Santonya Scott from Blue Cross Blue Shield of Illinois to discuss Medicare Advantage. And she joined Blue Cross and Blue Shield of Illinois in 2019. She started her career in the healthcare industry in 2016, where she found her passion for working with the aging population. And as a Think Blue ambassador, Santonya has built and maintained strong relationships in the community by implementing Medicare community outreach programs, organizing events, and volunteering. Her mission is to serve Blue Cross and Blue Shield of Illinois members and communities and help them live better, healthier lives, one person at a time. So I'll go ahead and turn it over. Thank you.
All right, good morning, everyone. Thank you, Emily, for the introduction. Today, once again, my name is Santonya Scott. I'm a community relations specialist with Blue Cross Blue Shield. Today, I'm going to be presenting a seminar on Medicare Advantage. I just want to go ahead and say, just before I get started on the seminar, this is annual enrollment. For Medicare, it starts October 15th through December 7th. This is the time to make any changes. If you're not satisfied with your current plan, or you may be turning 65, to change your plan to a new Medicare plan. So just like to tell people, my position, I do go out in the field to educate aging seniors about our Medicare plans, different updates on Medicare, just in general. I know a lot of people see a lot of commercials on TV, get a lot of mailings. Don't feel like as seniors that you are pressured to make any changes. My famous saying I tell when I go out in the community and educate, if it's not broke, don't fix it. So if you're satisfied with your current plan, don't feel pressure to change. Just be wary. This is a high time for scams for seniors. So a lot of times, people will call you, once again, trying to pressure you to change. Don't feel like you need to change. Also too, for this year, update just on Medicare in general. If insurance agent or insurance company is calling you about Medicare in general, the calls are all being recorded. So if they're not recording your call, then if they're not giving you that this call is being recorded for quality purposes, then that that's not more than likely legit, because that is something going forward for 2022, going into 2023, all calls need to be recorded. So just wanted to give you a little FYI on that. So I'm going to go ahead and get started on the presentation. As Emily stated, she will be sending a survey out at the end of this seminar. And also any questions that you may have, you can place them in the chat, or you can just please hold them until the end of the seminar, and I'll answer any questions that you may have. Thank you for joining. I'm going to go ahead and start the presentation. All right. So this is the benefits of Blue. This is a Blue Cross Medicare Advantage plan overview for the Chicagoland area. Yeah. At Blue Cross Blue Shield of Illinois, we're helping you get the most out of your health plan with affordable quality coverage and a strong doctor network. Once again, my name is Santonya Scott. I'm a community relations specialist, and I am also a licensed to sell health insurance of Illinois. I'm also certified to sell Medicare Advantage and prescription drug plan products for Blue Cross Blue Shield of Illinois and may be compensated based on an enrollment in the plan. Just want to let you know we're here for you, Blue Cross Blue Shield. We're here to help you make an informed decision about selecting a Medicare Advantage plan along with a prescription drug plan. So here's how our plans put you first. We are dedicated support services in person and over the phone. We have an extensive provider and pharmacy network. Our pharmacy network consists of Mariano, which is Kroger, Walgreens, and Walmart. We have excellent benefits depending on the plan that you choose. And we also have comprehensive coverage. And we are the leading local choice for health coverage in Illinois. Also, here's how we keep you healthy. We have an over-the-counter allowance. There is a $70 allowance every 3 months, which is quarterly, for purchasing over-the-counter healthy products available at Blue Cross Medicare Advantage Basic HMO and Blue Cross Medicare Advantage Choice Plus PPO plans. So those are the plans that you will allow a $70 allowance every 3 months. If you do want the number where you can contact for them to send you a catalog for those over-the-counter drugs, I can provide that information at the end of the seminar. Also, we have a $75 allowance, which is also every 3 months quarterly for purchasing over-the-counter health products available on Medicare Advantage Premier Plus and Blue Cross Medicare Advantage Classic PPO plans. So then we go up to $100 allowance, and that's also every 3 months for purchasing the over-the-counter health products available on Blue Medicare Advocate Health HMO and Medicare Advantage Basic HMO. So you see that the HMOs give you more money than the PPOs, but these are the breakdowns of how much you can get every 3 months for the over-the-counter prescription drugs. Then the last one is $105 allowance every 3 months for purchasing over-the-counter health products available on Blue Medicare Advantage Basic Plus HMO POS plan. And then just keep in mind the unused over-the-counter medicine amount do not roll over to the next calendar year. So if you don't use it, you lose it. Also, we have a prescription drug coverage, depending on the prescription drugs you take. That also depends on the tier of your medication. If that's something that you're not sure of, we can also go over that on a one-on-one basis. We do provide the Silver Sneakers Free Fitness Program, which is very good. Of course, because of the pandemic, they have done a lot of the Silver Sneaker programs virtually. So if you're not able to go out to a participating gym that accepts the Silver Sneakers program, you can do it virtually. And just keep in mind, the Silver Sneakers program is free to you if you do have a Medicare Advantage plan. Also, we have the Telehealth, which was created more over the time that during, once again, the pandemic, people weren't able to go out to the doctor. So you can do a one-on-one face interaction with your provider, either on your phone or your tablet or your desktop computer. We do also have a 24/7 nurse line where you can have any questions with your nurse that you feel that's not emergency, of course. You can call our 24/7 nurse line. And then also we do have a flexible spend card on Blue Cross Medicare Advantage Health Choice PPO plans. I will talk about that later on in the presentation. And then also too, excuse me, we have close coordination between healthcare providers. And that's just basically saying that we do keep coordination with providers. We do know time to time that providers move from different hospitals, different clinics, and then also they do change their health service provider. So we do try to keep into close coordination with them so we can provide that information on any changes that may happen on a month-to-month or yearly basis. Now I'm going to discuss the Medicare Basics. So are you eligible for Medicare? So if you're 65 or older, you're definitely eligible for Medicare, but you can also be under 65 with certain disabilities. So that means any age with end-stage retinal disease, which is also a permanent kidney failure requiring dialysis or kidney transplant, or diagnosed with ALS, also known as Lou Gehrig's disease. So these are the things that would make you eligible for Medicare. So that now I'm going to discuss the ABCs of Medicare. So some of this may be something that you're familiar with, but it's always good to have a refresher just in case you might have forgotten or need to have to communicate this information to a family member. So I'm going to start with Part A, which is your hospital insurance, also known as your original Medicare. It helps cover your inpatient care in hospitals, your skilled nursing facility care, hospice care, and home health care. So while most Americans are enrolled automatically in Medicare Part A, it alone may not cover all healthcare costs. Parts B, C, and D are voluntary programs that provide additional coverage. So just keep in mind, Medicare is responsible for 80%. So that means you will be responsible for 20%. So now we're going to go to Part B, which is your Medicare insurance, also known as original Medicare. It helps cover services from doctors and other health care providers. It also covers outpatient care. It covers durable medical equipment such as wheelchairs, walkers, hospital beds, CPAP machines, or other equipments and supplies that you may need for your home. And then also many preventive services such as screening shots and yearly wellness visits like mammograms, colonoscopies, and flu shots. So just keep in mind, if you do not enroll in Part B when you're first eligible for Medicare, you may have to pay a penalty later. So if you have credible coverage because you're still working with an employer of 20 more employees or your spouse is working, that is considered credible coverage. You do not have to enroll into a Part B if that is the case. But if you do not have credible coverage, you will have to enroll in a Part B when you turn 65, or you will get a penalty for each year that you do not enroll. So now I'm going to go ahead and transition to Part C, where a lot of people kind of get confused with the different letters of the alphabet. So the Part C is separate from your original Medicare A and B, which is known as your red, white, and blue card. So Part C is a Medicare Advantage plan. It refers to a Medicare Advantage program where members can enroll in a private health plan. Part C is an alternative to original Medicare's Part A and B because they only pay 80%. And it may or may not cover prescription drugs. So depending on the plan that you have, Medicare Advantage, it may or may not cover prescription drugs. But the Part C is considered an all-in-one plan. So now I'm going to go into Part D, which is your prescription drug coverage. It covers outpatient prescription drugs through private plans that contract with Medicare. If you don't enroll in Part D when you first are eligible for Medicare, you may have to pay a penalty later. So once again, it has the same guidelines like the Part B. If you do have credible coverage, either through your spouse or yourself, you're working with an employer with 20 or more employees, that is considered credible coverage. So you will not get penalized as long as you have that. But if you turn 65 or you're no longer working after 65, if you do not enroll into that Part D, you will get a penalty for each year that you do not enroll. So what is a Medicare Advantage plan? So of course, like I mentioned earlier, you're going to see a lot of commercials right now, a lot of mailings and talking about a Medicare Advantage plan. So it's a Medicare Advantage plan, sometimes called Part C, which I've mentioned just a second ago, or MA plan is an all-in-one alternative to original Medicare's Part A and B, which once again is your red, white, and blue card. And Medicare Advantage plans are offered by private companies and are approved by Medicare. So Medicare Advantage plans bundle together. So you have your Part A, which is your hospital insurance. Then you have your Medicare Part B, which is your Medicare medical insurance. And then it works together with your Medicare Part D, your prescription drug coverage. So it's a plan that bundles together. So Medicare Advantage plans are not Medicare supplement insurance plans. They are two different plans. They are different from Medicare supplement insurance. So keep in mind, you cannot have a Medicare Advantage plan and a Medicare supplement insurance plan at the same time. So either you can have one or the other. So here are some Medicare Advantage key takeaways. When you join a Medicare Advantage plan, it is important to remember you are still in the Medicare program, and that's your plan. You must follow Medicare's rules and notify you of any changes before the start of the next annual enrollment period. Will pay for your Medicare eligible services and must offer the same benefits as original Medicare, Parts A and B, plus other benefits and services that usually have different rules, costs, and restrictions. So just keep in mind, when you go to the doctor, you would show your plan's Medicare Advantage card, not your Medicare card. So if you have a Medicare Advantage card, you would show that, you would not display your Medicare card. Blue Cross and Blue Shield of Illinois Medicare Advantage plan. So I'm going to go over those plans. So a plan with advantages for you, we have an HMO, a HMO POS, and PPO plan options, and includes extra benefits. So just a refresher on which each acronym stands for. So let's start off with HMO. It's a plan. HMO plans typically have a lower monthly premium in a particular network. Then we have HMO POS, which is a point of service plan. It has a lower premium than a PPO plan, but still provides options choosing healthcare providers. So it gives you more of an option than HMO. So it's kind of HMO POS, is in between an HMO and a PPO plan, if that makes any sense. So then we also have a PPO plan, which tend to have a higher monthly premium at times in exchange for the flexibility to use providers both in and out of network without a referral. So that depends on which PPO plan you may choose. Then up to a $100 gift card yearly for completing healthy actions. And then you can have a zero to low copay for primary care providers, PCP visits and network. And then you have the ability to add dental, vision, and hearing coverage for a low monthly cost. And then it also provides you transportation. Now, as far as the transportation, they do allow you up to 12 one-way trips every year to plan approved locations on Blue Cross Medicare Advantage Basic HMO plans. And then also Blue Medicare Advantage Premier Plus HMO plans, Blue Cross Medicare Advocate Health HMO, and Blue Cross Medicare Advantage Choice Premier PPO plan. So those are the plans that provide the 12 one-way trips for transportation, and then also up to 24 trips on Blue Cross Medicare Advantage Basic Plus HMO POS plans. So those are the plans that provide the transportation. The benefits that put you first, we have prescription drug coverage, includes low copays, depending on the tier of the drugs that you have, prescription drugs. We have a network of nationwide pharmacies. As I mentioned, Walgreens, of course, is is nationwide. Then we have Jewel Osco, and then we have Walmart, and then Kroger, which is Mariano's. All Medicare Advantage plans include tier 1 coverage in the gap, and then a low copay for 30-day supplies, tier 1 drugs at our preferred network pharmacies. Also, benefits that put you first, we have additional benefits that may be part of your plan, include dental services, which are your preventive dental, your comprehensive dental. Then so we also can provide vision care, which is routine eye exams, which is 2 x-rays, two exams a year. That's for your dental, I'm sorry. For the vision, it's routine eye exam. And then we have an allowance for frames and contacts. So depending on what plan you have, we'll give you the allowance for that, for your frames or contacts. And then hearing care, which is your routine hearing exam, which also has a hearing aid allowance for your hearing aid. So here's a breakdown of optional supplement benefits that you may add on to your Blue Cross Blue Shield Illinois coverage for as low as $36.40 per month. Include your preventive dental coverage, which is zero cost sharing for 2 oral exams, 2 cleanings, 1 bite, weight, and x-ray. The breakdown for your comprehensive dental coverage is 80% co-insurance, and that includes your basic restorative, non-surgical extractions and scalings, 50% co-insurance for your major restorative services, such as oral surgery, crowns, and dentures. And then you have $1,000 per year max. That's $1,000 for the whole year for your preventive and comprehensive dental coverage. And then for your vision services, there's a zero copay for your lenses, and then $150 allowance that you can use towards your frames and contacts every year. The hearing services is a zero copay for your routine hearing exams. And then they give you $1,000 annual maximum on hearing aids every 3 years. So optional supplement benefit package offered on 10 Blue Cross Medicare Advantage plans in the Chicagoland area. So now I'm going to go more into the flexible spend card benefit. So our plan offers a preloaded flexible spend MasterCard with an annual limit of $1,000 to help reduce your out-of-pocket expenses for dental, vision, and hearing services. So not a MasterCard for you guys to go shopping and buy, some miscellaneous things. It's used for your dental, vision, and hearing services, which is pretty good. So that means you don't have to use any of your out-of-pocket, your money out of your pocket. This card cannot be used for purchases at pharmacies and other retailers and cannot be used for cosmetic procedures. The benefit does not replace your dental, vision, or hearing benefits. The card is only for your personal use, cannot be sold or transferred, can only be used at your dental, vision, and hearing providers, and it has no cash value. So just an extra benefit outside of your regular benefits that's included in your Medicare Advantage plan. And then unused benefit dollars will expire at the end of the year. So just keep in mind, a flexible spend card benefits offered on the Blue Cross Medicare Advantage Health Choice PPO plan only. A reimbursement is available if your provider does not accept MasterCard, or in the event of a card transaction failure, you must submit a claim for reimbursement along with the original printed itemized receipt for the provider location. Claims may be submitted within 90 days of the date of service on your receipt. New MAPD specialty plans. So Medicare Advantage only Part B buy down. This is a new RX benefit good for veterans who use the VA for their prescription drugs. It offers Part B premium buy down for $40 back on members' Social Security checks. And also a MAPD Part B buy down is good for cost-conscious Medicare members. Offers Part B premium buy down for $40 back on members' Social Security checks. And also we have a new MAPD plan for enhanced dental, which give you a $5,000 allowance towards dental benefits, including crowns and dentures. So these are the new plans that we have going into 2023. A Medicare Advantage only on Blue Cross Medicare Advantage Protect PPO plans, and a Medicare prescription plan buy down on Blue Cross Medicare Advantage Saver Plus PPO, and enhanced dental on Blue Cross Medicare Advantage Dental Premier. So these are the plans that we have for the MAPD Part B buy down, and also the enhanced dental with the extra allowance, $5,000 allowance towards your dental benefits. So now I'm going to discuss the plan's extras. Blue Cross Medicare Advantage plan benefits your preventive care and additional services. There's a 0 to low copay for your annual physical exam and network, or 0% coinsurance or for our PPO Flex plan. So the PPO Flex plan is a new plan that we have that has a 0 to low copay for your annual physical exams and network, and then 0 coinsurance for your coinsurance that you do not have to come out of your pocket. So the only thing you pay is your monthly premium. It has travel benefits available for members who are out of the service area for up to 6 months. So if you're one of those people who do go out to Florida or to some warm place during the winter, this might be a plan that will be beneficial to you. So now we're going to talk about the Blue Cross Medicare Advantage plan benefits, which is going over your prescription drug coverage. So what count towards your initial coverage limit? So $4,660 is your initial coverage limit. So the initial coverage limit is the total retail value of formulary drugs you can buy before leaving your plan's initial coverage phase. Could be a $0 to $505 deductible, depending on what tier your prescription drugs fall in. And then also keep in mind, it could be a co-payments and co-insurance that go along with that, and what your plan pays for the drugs. Now we're going to talk about the built-in prescription drug coverage, which is next is your coverage gap. And that is the amount of $4,660 to $7,400. Now the coverage gap is also known as the donut hole. So you might have heard that term before. That means there's a temporary limit on what the drug plans will cover for drugs. So the coverage gap is reached after $4,660 amount in drug costs. You go into the donut hole. All Medicare Advantage plans include tier 1 coverage gap until you reach that $7,400 in true out-of-pocket costs. Then you're out of the donut hole. So the next phase is what you call the catastrophic phase, and that's when you meet that $7,400 mark. Medicare pays 95% of your approved out-of-pocket true max, which is the total $7,400. So the catastrophic coverage is the point where your total prescription drug cost for the calendar year has reached a set maximum level. At this point, you're out of the donut hole and your prescription coverage begins paying for the most of your drug expenses. So depending on your drug prescription that you take, you may not ever get to this point. But if you do take a lot of prescription drugs that are more costly, you can fall into the donut hole. You pay the greater of 5% of the cost or $4.15 copay for generic and brand drugs treated as generics, or $10.35 copay for all other drugs. So you may be ready to enroll. Do you qualify for enrollment? So first of all, you have to have your Medicare Part A and B coverage, enroll in the Part B, and continue to pay your Part B premium. So good news, the Part B premium will be going down next year, 2023, to $164.90. I know it did go up this year, like everything else. That's going on because of the pandemic. So it will be going down effective 2023 to $164.90. So every few dollars counts, of course. And then also, if you live in the service area of the plan you want to join, you do qualify to enroll into a plan, a Medicare Advantage plan. So now I'm going to talk about the different enrollment period. So the first one is the initial enrollment period. So this is when you're turning 65. You sign up anytime 3 months before your 65th birthday month until 3 months after. So that is your window. Your effective date usually is after the first day of the month following enrollment of the first day of your birthday month. So this is when you're turning 65. Then the annual enrollment period, which is right now, also known as AEP. It started on October the 15th. It goes all the way up to December 7th. And that's either enroll for the first time or you can switch plans, and your effective date will be January the 1st. Then we have a special enrollment period, which is change in life status. So that might be losing your credible coverage with your employer, a marital change status, and then also moving to a different state. That would trigger a special enrollment, and their effective date is usually the first day of the month following enrollment. So what are your next steps? You can review your provider directory and make sure your doctors you see are in network. That is very important, especially if you have a set doctor that you've been seeing already. And then review your pharmacy directory and make sure your pharmacy you use is in our network. And then review your summary benefits. So it's important to know what the benefits that in each plan consists of and whether or not it suits your personal needs. And then you can also talk to a licensed authorized insurance agent like myself. So taking advantage of open enrollment, that is January 1st to March 31st. So if you would like to change your Medicare Advantage plan coverage after the AEP, you may choose to switch to original Medicare Parts A and B and purchase a standalone Part D plan. During open enrollment, you may also choose to switch to a different Medicare Advantage prescription drug plan or a different Medicare Advantage only plan. So if you change during open enrollment, you do have, during AEP, which is now, it does trigger an open enrollment of the first of the year to March 31st. You can change back either to your original Medicare with a standalone Part D plan, or you can change to a different Medicare Advantage plan. Tools that can help you. So we have Blue Access for members. We have online wellness tools and resources where you can find out updates on flu shots, shingle shots, what's going on with COVID. The different variants are coming out, so we do have different resources for that. You can access your via mobile app where you can download your card if you lose it, or look up your claims, medical and pharmacy claims. And then we have a network of provider and pharmacy search. That's all on your Blue Access for members. And then we have education, connect member email newsletters that we send to our members about what's going on new with Blue Cross Blue Shield. And then we also have seminars like the one that we're on today. You can find all our seminars on our website, which is www.bcbsil.com/Medicare/seminars. And then also we have health fairs and community events. So since we are back out in the field, we do over the summer, especially, we have a lot of health fair and community events. We're still having some now. It does kind of simmer down towards the winter months, but feel free to go onto the website. Depending on the area you live, there's a lot of things going on that you might want to join, and everything is free. Help is always available. So we have Medicare Resources. You can go to www.medicare.gov or call the 1-800-Medicare. Also, you feel free to go to for Social Security if you have any questions with them, www.ssa.gov, or you can call them 1-800-772-1213. So this is your available resources. So if you want to jot these numbers down in case you don't have them, or the website, you can feel free to do so now. So I'm going to leave this up for a few minutes in case anyone wants to write it down.
We do have a question. Are we ready for questions now?
I'm on a couple of more slides.
Oh, sorry.
Yeah, no, almost done.
Okay.
So this is additional information. Then it's going to conclude the seminar. Just bear with me on this part, please, everyone. This information is not a complete description of benefits. So you can call 877-260298 for more information. Out-of-network, non-contracted providers are under no obligation to treat Blue Cross Medicare Advantage members except in emergency situations. Please call our customer service number or see your evidence of coverage for more information, including the cost sharing that applies to out-of-network services. Blue Cross Blue Shield and the Cross of Shield symbols are registered service marks of the Blue Cross and Blue Shield Association and an association of independent Blue Cross and Blue Shield plans. Our Silver Sneakers is a wellness program owned and operated by Activity Health Incorporated, an independent company. Activity Health and Silver Sneakers are registered trademarks or trademarks of Activity Health Incorporated and or subsidiaries and or affiliates in US and other countries. Additional information. Prescription drug plan notice, prescription drug plans provided by Blue Cross and Blue Shield of Illinois, which refers to HCSC insurance service companies, an independent licensee of the Blue Cross Blue Shield Association, a Medicare approved Part D sponsor enrolled in HISC plans depends on contract renewal. Medicare Advantage plan notice, HMO, HMO POS, PPO plans provided by Blue Cross and Blue Shield of Illinois, which is a division of Healthcare Service Corporation, which is also a mutual legal reserve company, HCSC. HMO plan provided by Illinois Blue Cross Blue Shield Insurance Company. HCSC and Illinois Blue Cross Blue Shield IC are independent licensees of Blue Cross and Blue Shield Association. HC and Illinois Blue Cross Blue Shield IC are Medicare Advantage organizations with a Medicare contract. Enrollment in HCSC and Illinois Blue Cross Blue Shield IC's plan depends on contract renewal. Additional information, almost done, everyone. I'm sorry. Blue Cross Blue Shield of Illinois complies with applicable federal civil rights laws and does not discriminate on the basis of race, color, national origin, age, disability, or sex. Blue Cross Blue Shield of Illinois does not exclude people or treat them differently because of race, color, national origin, age, disability, or sex. Blue Cross Blue Shield of Illinois provides free aids and services to people with disabilities to communicate effectively with us, which is qualified sign language interpreters, written information on other formats, large print, auto accessible electronic formats or other formats. It also provides free language assistance service for people whose primary language is not English, such as qualified interpreters, information written in other languages. And if you need services, contact our civil rights coordinator. Almost done. Hang on in there, everyone. If you believe the Blue Cross Blue Shield of Illinois has failed to provide these services or discriminate in another way of basis of race, color, national origin, age, disability, or sex, you can file a grievance with our Civil Rights Coordinator, which is our Office of Civil Rights Coordinator, which is 300 East Randolph, 35th floor, Chicago, Illinois, 60601. You can contact them on this number, 855-664-7270. You can file a grievance by phone, mail, or fax. If you need help filing a grievance, a Civil Rights Coordinator is available to help you. You can also file a civil rights complaint with our U.S. Department of Health and Human Services Office for Civil Rights electronically through the Office for Civil Rights Compliant portal available on our website. And we have free interpreter service to answer any questions you may have about a health or drug plan. To get an interpreter, you can call us at 1-877-774-8592, or someone who speaks English language can help you with this free service. Can't speak English, Spanish, so I can't read that. And thank you for being so patient with that long additional information. But that does include my presentation and the benefits of Blue. So we can now open the panel for any questions and discussions. Thank you guys for joining us today for this Medicare Advantage seminar.
Okay, thank you. That was great. So we had someone on Facebook ask if they can get a copy of the slides.
Well, for CMS guidelines and for our Medicare Advantage, I cannot provide the slides. If they want to provide their email address, if there's anything additional that they're looking to need, I can email them, or we can have a one-on-one conversation outside of the seminar.
Okay, I will let her know.
Yes.
We also had a question from somebody that's looking for an example of how much it would cost if they were to go to the ER for chest pain.
Okay, and once again, as far as pricing, as far as the guidelines, I'm unable to go over the pricing of more of a breakdown with the Medicare Advantage plans for CMS guidelines. So if they want to have a one-on-one conversation with me about what the Medicare Advantage plans consist of, as far as the co-payments, how much you'll pay if you go to the emergency rooms, things of that nature, we can set up a one-on-one meeting either virtually, over the phone, or in person. And we'll have to sign a scope of appointment before we can discuss anything in more detail.
Okay, can you put your contact information in the chat for everybody?
I sure can.
In case they have individual questions, they can reach out. And let us know if you have any questions. You can put those in the chat or the Q&A.
And for those people that are on Facebook, my email address is SANTONYA_Scott, SCOTT, like Scott Tissue, at bcbsil.com.
And then you can always reach out to ElderWorks as well if
Yes.
you ever need her information or any of our speakers' information. We have it. So
Yes.
does anyone else have questions about anything?
Any general questions about Medicare or just anything?
I'm not seeing any.
Okay. Yeah, just like I just wanted to just reiterate again, just keep in mind, do not feel pressure to change your plans during this time. I know you see a lot of misconceiving information on TV, not saying that it's misconceiving, but it's interpreted wrong, may I say that, because it's just wants to get your attention for you to call. So what you're seeing on TV is not necessarily everything, that giving all the information at once, which, you know, of course, since it's a commercial, they can only tell you so much at one time. But like I said, don't feel that you need to change a plan because you're seeing things on commercial or the mailings. Of course, if you feel like you're having some concerns with the plan because it's not working for you, or as far as the pricing or having change of health, and you feel like you need more coverage, that's definitely reasons for you to want to change your health plan during this time.
And I did put the link to our survey in the chat. If you'd like to provide some feedback, let us know what you thought of today. So we'd appreciate that.
Yes, feedback is always good.
Okay, I think we'll go ahead and wrap things up. Thank you, everybody, for coming, and thanks to
Thank you.
Santonya for a great presentation.
Yes, always a pleasure to work with you guys at ElderWorks and provide information to our
Oh, do you want to let everyone know about your next presentation in November?
Yes.
Let's pull up the date here. Yes, so you'll be back November 17th at 10 a.m. discussing supplemental insurance plans.
Yes, supplemental plan. So those who want to join us to hear me do a seminar on the Medicare supplement plans, feel free to register like you did for this event, and I will be discussing supplement plans for Blue Cross Blue Shield.
Okay. We hope to see you back, everybody attending here. If you'd like to come back and learn about supplements. So thanks,
Yes.
everyone.
All right. Thank you, everyone. Have a good day.
Bye.
Bye.